So now that we understood a little bit about the complexity of obesity and what obesity is, we can start to understand what weight stigma is. So the definition, or the official definition of weight stigma, is the discriminatory acts and ideologies targeted towards individuals because of their weight and size. So it's the discrimination or treating differently or unfairly someone because of their body size, and also all of the preconceptions and stereotypes that people have towards people with overweight or obesity. Stereotypes such as people are lazy, they're overeating, they have poor health. A stereotype that's very common in the healthcare setting is people with overweight, probably all of their health problems are because of their overweight. Probably they are not going to adhere to whatever we tell them to do, to the treatment plan, and many others. So weight stigma manifests in various domains of life, such as healthcare, the workplace, interpersonal relationships, among others. But in this talk, we're going to focus on weight stigma in the healthcare setting. Something that's really dangerous with weight stigma is when people sort of internalize this weight stigma, meaning when people start to believe these preconceptions that people have about them. They start believing those things about themselves. They start thinking that they are actually lazy, that they're actually unhealthy, that it's all of their fault, that that's what they are. They sort of identify with those ideas. And it's very dangerous because this leads to many problems related to mental health. And also this deterministic mindset of this is who I am, or this is what I am, makes it very difficult to change, to engage these patients in treatment plans or in changing these behaviors, because they already sort of identify with these stereotypes and these preconceptions. Another way of sort of where weight stigma can happen or show in the healthcare setting is through medical equipment. A lot of people don't realize this or don't think about this, but medical equipments and facilities are often not designed to accommodate larger patients. So if you think about it, just to give an example, so in our lab, we usually treat people with obesity. Most of our participants are people with obesity. So we know that we need to have larger sitting or larger chairs in our waiting room. We know that we need larger blood pressure cuffs in our clinics because most of our patients have larger arms. We know that we need scales that go higher than 300 pounds because we know that a lot of our patients weigh more than that. We need to have different equipment that is sort of accommodating to larger patients because that is our population. A lot of healthcare settings do not have facilities or medical equipment that is designed for larger patients. And most, or I wouldn't say most, but a lot of clinics do not have blood pressure cuffs that can accommodate larger arms or scales that go higher than 300 pounds. Some people would say, okay, why should I invest or change my infrastructure for those few larger patients that I have? I think that's a valid point. However, if we think that about the slide that I showed you earlier, that almost half of the US adult population is in the obesity category, then you start realizing that's probably not a few patients and probably almost half of your patients. If you also work on a specific condition where most of your patients are overweight or obese, then probably even more of your patients will need those specific facilities or medical equipment. And this is not validating obesity. Some people would say, okay, so if I sort of change all of my environment to accept or to accommodate people of larger sizes, this is like sort of accepting obesity. Not really. This is just acknowledging the reality of this country, and it's just making your practice more welcoming and more accommodating for people of larger sizes and making them more likely to come back and to adhere to the treatment. And that's something that we'll discuss in a few slides.